do you have any advice, recommendations on how to set and calculate fees for large, complex tooth surface loss cases? Again, we'll go through that on the hands-on when you come in, but essentially look at what you're doing. Is it going to be crowns or is it going to be composite? And if it's going to be something like that, look at what you would be charging per individual tooth and then multiply it by the number of teeth that you're going to be doing. I would advise that you be careful with discounting, because the thing you'll think is, oh, it's multiple units, I'm going to be doing more of them. However, these are often bigger, more complex cases. So what you need to do is factor that in, and it will take a little bit more time. Also factor in with large tooth surface loss or complex cases. You'll have done your risk assessment. There's often reds, maybe they're a parafunction or something. So with bigger failing dentitions, you can often expect more failure of your restorations. Not dramatic, but factor into the cost that if you're doing more repairs, etc., I would advise guaranteeing everything for perhaps a year or so. And then after that, you may need to charge for the maintenance. However, in the early stages, expect a little bit more failure because these are compromised cases. So if it's a large case, if it's crowns or composite, simply multiply this by the number of units. If it's a complex case, factor in if it's laboratory provisionals. Now, if it's laboratory provisionals you're using, check with the lab how much they're going to charge you. They could be 30, 40, 50, or even more expensive than that, so factor that in. Apart from laboratory provisionals, if you're doing your own provisionals, but you're going to have to do a second stage impression, i.e. fit provisionals, take them off and do a second stage impression, factor in the costs for that. The other way to factor costs, again, is looking if you work on an hourly rate, that if you work for perhaps, say, a corporate of some type, as a private associate, they'll be expecting you to earn maybe about £200 an hour or more. So factor in, if you think this work is going to take you 2 or 4 hours, factor in that cost as well. So say you're going to be taking off some provisionals, you're going to basically impression it, but you've already got your crown charge, charge something like £400 if it's going to take you 2 hours. So we will talk about that more, but that's a good place to start in terms of costs. Obviously for things like full dentures and for things such as cobalt chromes, you'll have your standard charges, which is fine to use. So just be careful not to undercharge. Certainly, you know, early on in my career, when you want to do more interesting and challenging cases, it's okay to perhaps charge less then, just to get the experience as you go forwards. So that's how I would look at setting and calculating the fees.